Welcome to this special Global Listening Project event. This video is premiering on our Global Health Diplomats and a Shot in the Arm podcast, Spotify, YouTube, and LinkedIn channels. And of course, the audio is available directly to global audiences on Apple Podcasts and all good podcast platforms. I'm Ben Plumley, here in Sacramento, California, and I'll be the host for this session. And joining us from the International Institute of Information Technology in Bengaluru, India, are the GLP's co-founder and chair of the Global Listening Project, Professor Heidi Larson. Heidi, welcome.
Nice to see you, Ben.
Joining Heidi, we have Prasada Rao JVR, who is the former UN Secretary General Special Envoy on HIV/AIDS in the Asia-Pacific region and former Health Secretary of the Government of India. Prasada is also a member of the Global Listening Project's International Advisory Board. Welcome, Prasada.
Thank you, Ben. Thank you very much.
And last, and by no means not least, Professor Balaji Parthasarthy. Now, Balaji, I hope I've got your surname pronounced correctly.
That's fine. That'll do.
In other words, no. But you're founder of the Institute's Center for Information Technology and Public Policy. And a deep thanks to you for inviting us to this Institute's fantastic space, although, of course, I can only see it virtually. Now, for viewers and listeners, please do send comments and questions because Heidi and I will be devoting an upcoming podcast, a sort of a question time podcast, to answer your questions and concerns. Now, the world faces a truly global trust crisis. And today, the Global Listening Project is kicking off an 8-month rollout of data from a global 70,000 plus people survey on how prepared they feel their societies are for future crises. And we will be discussing insights today from the study for global security, an issue of increasing concern as we enter 2024. Heidi, perhaps a bit of context first then. Going into COVID, what made you think you needed to be concerned more broadly than just vaccine confidence?
Thanks, Ben. Well, after founding the Vaccine Confidence Project in 2010, 2020 was 10 years later. We had built a global network of researchers investigating all the reasons that people were questioning and some not taking vaccines. We uncovered many layers of trust that were not specific to the vaccine. And in the meanwhile, more and more people came to us from other disciplines, climate change, mental health, others, to ask us to help them with trust issues. So we were thinking about calling ourselves the Confidence Project, and then had the fortune for MacArthur Foundation to award us at the beginning of COVID a grant on addressing inequity and injustice in the context of COVID response and recovery. And that really helped us take our work beyond. And we started to look at all the different trust dynamics in the multiple interventions that were needed to protect the world from COVID, including vaccines, but as everybody knows, distancing, masking, multiple things, and for a long time. So that really helped. And then GSK and Moderna loved this concept because it was not about the product. It was about all the underlying issues and trust environment. And then Gates Foundation, we were very grateful, supported us to take a special look at gender. And it's been a fantastic growth since then. And it's trying to take the bigger issues of trust that are reported on left, right, and center, but try to make that understanding more granular so we can actually know, where do you start building trust? Because to say they don't trust government Well, where is the issue? They don't trust media. Well, there's good media and bad media. There's good NGOs and bad, less good. So we need to find out more of the details, but from the people's perspective. And what I love in this project, it is very much from the start informed by what people have told us around the world about their experiences.
So you said it's not the Global Confidence Project. Why listening? What is so important about listening?
Well, we wanted to feature the listening because, to be honest, one of the things we've heard around the world just in our very early formative research was one of the biggest issues for people during COVID was they felt voiceless. People felt like they spent all their time following instructions and they weren't heard. They had no voice. They were being told what to do continually. And the number of people that said, you actually care what we have to think about this, was really striking. So it just was something that came to us, inspired us, and actually resonated. So we called it the Global Listening Project. It's not, and also I felt like listening itself was an intervention. People needed to talk about theirs. They wanted to talk about it. It helped them kind of process what they've been through. And it's not just listening for the sake of listening or for that moment of listening. It's very much to inform where we need to build trust, what innovation we can build on. There was some fantastic creativity and innovation in COVID, as well as some broken trust, which we also learned about.
So, Prasada, if I could come to you, you're a member of the International Advisory Board that has guided Heidi and the team over the course of the last, 18 months or so. What intrigues you? What captivates you about the Global Listening Project?
But when I heard about the Global Listening Project and Heidi sent me the concept note, I found that is something new that is happening in the area of HIV, in COVID, because COVID had many facets, and being a member of the National Task Force on COVID for India, I could see the entire response emerging from the word go, and something that was missing in the entire response was this particular thing called listening. I mean, it was a very top-down type of response that countries had. I mean, including India, I would say, whereas people were just like objects. They were not subjects. So unless you listen to them and know their perception of what is happening, whatever is happening, is it relevant to them? I mean, your response is not appropriate. And then I compared it with what happened in HIV 20 years back, where I think people were listened right from the word go. I think the entire response started with the people, with the communities. So that's what fascinated me. And all the time when I was working in the project, I was comparing the COVID response and the HIV response, and I found the contrasts in the two. So that's what is absolutely fascinating in this particular project.
Balaji, you are a global expert on information communication and technology, and you established the Center on ICT and Public Policy at the Institute. What do you think about the goals and objectives of the Global Listening Project? Listening as opposed to communicating.
Yeah, I think this is something, this is a compelling idea, is what I'd say. And to sort of justify what I said, let me step back and give you a little bit about what I've done in the past and how I sort of come to view this. I've, for a long time, studied technology and its social implications, social consequences and impacts. And one of the things is that, technology doesn't play out identically among different social groups across national boundaries. So you willy-nilly have to take a comparative approach if you want to understand the consequences of technology. You have to ask technology for whom. And then once you ask that question, then you have to ask the question, why? right? So you have to get to the bottom of that. So then you start to realize that technology, you have to sort of start unpackaging it, right? And then look at not technology as technology alone, but then how it sort of filters through a set of institutions, national institutions, local institutions, individuals, right? So there is great granularity in terms of how we have to even think about trust, which is one of the themes of this project, right? So this allows for that. Now, when you start thinking about it, disaggregating it and unpackaging it, right, then you also realize that, when you're looking for or looking to address challenges such as it might be COVID or anything else, right, more often than not, you have a set of experts, right, at the top who pretty much, dictate how things get done. But on the other hand, having been a researcher who sort of believes in sort of a sort of empirical grounding, so a lot of what we do. And when I say empirically grounding, this is not to say that the technology, the scientists who put it together have been sort of waving their hands. No, not at all. But in terms of the social consequences, to believe why something will work, you do need to actually go there to the field to get a sense of how things are playing out. And I've been doing that for a large part of, I do that for a large part of my research, and to see that kind of listening to the people who you think should benefit or will benefit, and to see how it actually plays out across norms, across various other social cleavages, I think is extremely important. And that's why I think a project such as this is very important.
Thank you. And I suppose, Heidi, that's pretty clear why you were so insistent that Balaji join us for this launch event. You, as an anthropologist, devoted to the art and the science of listening, I suppose, but looking at it through Balaji's conceptual framework.
Well, what really impressed me about Balaji's work was the link to society. It's one thing to look at trust in technology in the sense of, how effective it is and if it works. And similarly with our experience with vaccines, you want to make sure they're safe and effective, number one. But then, whether it works is really going to depend on the situation it lives in, how it plays out, whether people want it, and the rest is nothing to do with the product. It's about everything about it, around it. So that really struck me. And also, one of the real aims of the Global Listening Project is also to derive from people what we're calling a societal preparedness index, because a lot of the work out there around preparedness for not just pandemics, there's a lot of pandemic preparedness initiatives, but in the Global Listening Project, we're looking at the experiences of society in the face of COVID as a crisis, and what can we learn to build societal cohesion and preparedness for another crisis, whatever it may be, whether it's a natural disaster, conflict, or other. So we're looking deeper than what the specific agent or cause of the crisis is. And that issue of trying to move towards preparedness and cohesion really resonated with the work that Balaji's been doing, and understanding that, society-technology interface, along with the multiple, technology also, you need policymakers to trust in it, believe in it. You need many parts of society. But usually society and local people are the last ones to have a say in how it's used, when in fact, the reality is they should be some of the early ones, because it could make you a more effective product. So anyway, and I think the other, just to frame it, the other big issue is that we're looking towards in the Global Listening Project is societal preparedness and cohesion as a fundamental part of security, human security, national security, global security. And that really is fundamental. And technology, every day, the quickly evolving possibilities with technology, if we don't get it right, it will be a huge security risk. And if we get it right, it can be a huge builder of security.
So it's Valentine's Day, February the 14th. What are we launching today, Heidi? Why is today so special, besides the obvious?
Well, we're launching today in the context of this week is the Munich Security Conference. Monday and the 12th was the launch of the Munich Security Report and their index, which is really important to have a look at. And also, I thought it was important of all the days in this week to pick Valentine's Day because the state of the world right now, frankly, needs a lot of love. So I thought that was the perfect one to land on. And I also, it just so resonated with sense of people's personal security in their community, and how that emotional fabric is so relevant.
Can you tell us a bit about the 70-country study that's going up on our website today?
Sure. Well, we started the global listening work in 6 major metropolitan areas around the world: Sao Paulo, New York, Abuja, Paris, Delhi, and Bangkok, just to pick different points in the world, cities that had very different experiences around COVID, to do a lot of focus groups, in-depth interviews, to hear from them what were their issues, what were their things that worked, things that didn't, what were the things that made them feel safe and made them feel scared. And from all of that, we tried to discern what were locally specific cultural or political issues and what were common themes across those different settings. So from those common themes, we built a survey. We wanted to understand the scale of these issues across the world, and that we rolled out that in 70 countries in nationally representative samples, reaching over 70,000 people in multiple languages. And in that survey, what we're launching this week, we've invested quite a bit in a very robust website where people can see the data from their country, can look at any other country, can look at the comparisons. So we're doing a kind of backwards approach to a typical launch, which would be a finished report. We're bringing the world along with us in one, sharing our data early. We don't know when the next crisis will be. We were encouraged by our International Advisory Board. Don't wait for the shiny report. Share your data as soon as you can. It's a resource. We never know when the next crisis will hit. Make it available to policymakers, to researchers, to funders, to other people. So we're launching that. We're fully available to work with people who want to look at it and its implications. We've been already doing a series of roundtables in different settings with different policymakers around their country. This week, we looked very carefully at including Balaji and Prasada and others on the data we learned about India. We've done that in Tokyo, in New York, in Washington, in Singapore, in Senegal, and we'll be doing more of that. And then we're going to open the chapters of the book, as it were, in each month. This month, we're featuring security. Next month, March, we'll be looking at the gender lens. And then we'll look at technology. And then we'll look at, in May, mental health. And then we'll be working towards a report that we'll release at the Summit of the Future in September, which there will have really the overall picture, including all the commentary that we've been gathering along the path. So this whole journey is being launched here on Valentine's Day towards the Summit of the Future.
And I mean, not only are you trailblazing in confidence around vaccines and building trust for future crises preparedness, but you're totally upending the way people launch reports and studies. I think it's fascinating. So To put you on the spot a bit, Heidi, are you able to give us a sense of what you feel are the top insights from the data that you've looked at already? What has surprised you and what has reassured or reaffirmed to you?
Well, one thing that struck me is really 70 countries in the world that we covered or listened to, 70 very different stories, some common themes, but how they played out was quite different. And also we have a lot of subnational data, so we could see variety within countries. But really, different things struck me in different countries, and we're doing sense-making and feedback in these different countries. In the US, for instance, 9 out of 10 men under 35 felt like the political leaders were listening to them and that they had voice. Only 3 out of 10 women over 35 felt that political leaders were listening to them and they had the voice. That's in the United States, which I found pretty shocking. That difference was quite eye-opening. In Cameroon, 63% of the respondents said they regretted getting a COVID vaccine. And when I talked to colleagues from Cameroon, from Africa CDC and others, in Senegal also with the Pasteur Institute, what do you think of this data? They said, it could have been my grandmother. The fact that a number of people did get their vaccine, urged and pushed by others, but then after the fact felt like, well, maybe they didn't really need it. And maybe, well, what about all those longer term effects? And maybe I shouldn't have. I was really, that high amount I found a bit surprising. It was very varied in different countries. Vietnam, on the other hand, had the highest sense of relief after vaccination. So how do we get people to feel like, from a security perspective, relief and a feel of protection and safety? Another thing that was really striking, we asked people about mental health. We asked, in the context of COVID, did you have any mental health issues like anxiety or depression, loneliness, or a sense of hope? And part of the survey work looks at people's emotions from anxiety, fear, anger, hopefulness, empathy, and compassion, and looked at how those moods changed over the pandemic. That was an interesting window, and that was different in different countries. And we saw, for instance, some populations had a very different perception of how their country did versus how they did. Japan had very low public sense that their government did well, when in fact their government did extremely well when you measure it by the number of cases and COVID deaths. But that's not what the public felt. And in trying to get social cohesion, we want to get the public experience to be closer to the reality. So that kind of cohesion is fundamental to security, to national security and human security. And in India, it was interesting. We had some of the highest number of people with reporting anxiety and depression during COVID, more anxiety, I think. And that surprised some people here, whereas in Senegal and Japan, they said they didn't have much, but the Ministry of Health would say, actually, we had higher number of suicides than usual. So we're also looking at how does the perception of publics compare to the technical story of how things went. We're also talking to a lot of colleagues. We want to get other people's reports, other people's information. We want this to kind of trigger a coalition, I guess, of insights around these different topics to put the full story together. And that's why our logo is a puzzle piece, because we're trying to get the missing voices in the puzzle so we get a coherent picture.
Balaji, how do you respond to that? Does that resonate with the work that you have done over the years? And I guess particularly this approach that the Global Listening Project has taken around to generating opinion research-based senses of people's perceptions, given the fast-moving flow of information and technology these days. Is it possible to capture the moment correctly and effectively so that policymakers can act upon that data?
Yes. I mean, yes and no. So sort of, I'm probably hedging my bets there, but let me say what I really have in my mind. Yes, you do have a variety of new technologies that are, keep coming. That flow is there. But so in that sense, the availability of these new technologies as tools to address some of these challenges that we face is a source of encouragement, because quite often these are problems that we might call wicked problems that where the target keeps moving. We haven't sort of had any, half decent solutions or ways of addressing them. So, there's hope. However, we can't therefore assume that people will necessarily react to those technologies or new sort of offerings in ways that we envisage them in, say, the laboratory, right? Because often their social and personal circumstances have not kept up. And rarely, even for people who are coming up with these technologies, our social, personal and economic circumstances don't sort of run with the flow of technology, right? We are sort of anchored in different ways in our own personal settings, right? So that's the reason why I think we really need to figure out how these technologies play out in a very granular fashion across, which is why this comparative study and by sort of disaggregating different sections of the population, whether it's by religion or caste or gender or race or whatever it is that you might sort of want to slice and dice the data, I think it's extremely important, because we can't assume that the latest, sorry for my using the word, the toy that we might have in terms of the technology is going to be the magic wand that is going to help us do away or sort of get rid of these challenges that we've not had very little success with. It shouldn't be the sort of, it has almost become like the last card we have, or we haven't been able to deal with this. This is probably going to be it. So that's how I sort of react to and react to what Heidi just said. And there's a bit about social cohesion. Maybe if there is time, I'll add to that later.
Yeah, you can.
Oh, we'll definitely come back to social cohesion, no question. Now, Prasada, you, like me, you much more effectively than me, I guess, long time work in the HIV movement. And I think an observation that you made to both Heidi and me during, I think, the second shutdown, lockdown in India, was that you saw the HIV community that had been forced essentially to organize for itself at the depths of a raging HIV epidemic in the country. But you saw it coming together and providing strength, resource, not only for the community that it represented, but for broader society. Could you talk a bit about that?
About HIV?
About the lessons that the HIV community brought to COVID.
Sure. I think, so I have to go back about 20 years. And, things were much different at that time. I think India also went through a phase of denial at the time, definitely. For about 6 years, I think we denied that there is a problem of HIV in India. It is a foreigner's disease, not so much ours. But later on, I think government really picked up. And the response that we have been able to put together, I think is one of the most comprehensive ones, at least I have seen in other parts of the world. And the most important component of that was that the emphasis on prevention. I think, again, that is something even now we are missing in a number of, I would say, global and regional and country level policy documentation. Even though it is there, but I think in practice it is not actually happening. I think, but India at the time put a huge amount of emphasis and also resources on prevention. especially prevention among the key and vulnerable populations. So that ultimately is what gave us the results. And the involvement of the communities. Right from the word go, I think the communities got organized very well. The sex workers, the injecting drug users, men who have sex with men, transgenders, one by one, they have been able to organize themselves. And initially I have seen, they were not even willing to listen. They were not even willing to get photographed. From that position, they could come within a period of 5 years to come and agitate for their rights and then take processions on the roads. This is a huge transformation we have seen in India. I think that's because of this bottom-up approach that was followed in the project, empowerment of those people. Empowerment was one of the very important components of the prevention work that we did. I think that is something which stood out at the time as a part of HIV response. And as I said earlier, when I compare that with what happened in COVID, even though these communities were also the most affected during COVID response, hardly their voices were heard. In fact, the sex workers lost their livelihoods. They are completely starving, many of them. The others were not able to access even the minimum services that the government has given to them. Of course, vaccination was a different story. The communities organized themselves to see that vaccine reaches them. But then the communities didn't sit idle. They didn't wait for the government to respond. They organized themselves. And in Bangalore itself, I can quote, there is a project called Community Action Collaborative, which is a collaboration of about 350 organizations working on COVID in various capacities. They have been able to synergize their efforts, mobilize resources, and reach benefits to the communities, including, awareness about vaccination, where to go, how to register yourself for a vaccine, many of these things. That's how the communities got empowered of their own and without any help from the government. That is the big contrast you find between the HIV and COVID. And I think the government at some point of time should have realized this and then brought the voices of the communities to the fore. But unfortunately, it didn't happen. And I realized it is not only in India, in many countries. I think this is absolutely type of, as I said earlier, top-down type of response we had. But the positive side was, at least the governments have learned the lesson the hard way. Maybe I will come to the preparedness part later on. Maybe we'll discuss it. But I think essentially this is the difference I saw between the two.
So this is a good moment to get into the concept then of trust and security that Heidi referred to at the start. And I guess a question, I guess if I may, Heidi, for the two gents before coming to you, is just how you define trust. And Balaji, I wonder if this sort of gets us into your thoughts around social cohesion. One of the things I have found absolutely fascinating about Heidi's work in the Global Listening Project is that trust essentially seems to be the missing piece that enables governments to talk and engage with their citizenry in ways that will enable them to mount effective responses, experts that actually want to help people. And so I just wonder how you see the role of trust in building social cohesion.
Yeah, I think there are two parts to this. One is, as somebody who has studied and who sort of firmly believes in the role of institutions, I think you first and foremost need these kind of institutional structures that will allow you to generate trust. I mean, let's take a simple example in the sense that do you have, for example, state agencies that are delivering, it might be vaccines, it might be education, etc., with a certain quality, right? Or do you much rather go to the private sector, right? For instance, in India, we've had a growing shift from the public sector, state-run education system to the private sector, and that speaks very loudly, right? And in many instances, you have where you have either state failure or because the private sector charging too much, you have the non-profit sector actually delivering a wide array of services, right? So you have this kind of institutional structure that you need for different kinds of areas. But then that in and of itself is not enough, because then you need to see the specific practices through which those institutions are actually reproduced. So, time after time, do the schools produce good results? What are the health outcomes from certain clinics? Or what is it, or how is it that my water gets delivered? Or those sorts of things. those kinds of practices on a daily basis through which citizens interact with those institutions or the faces of those institutions becomes very crucial to building trust, because it's not a binary variable. It's not as though it is there or not there, but you have shades of that, and then you see that being reinforced or being eroded over a period of time. Okay, so this is insofar as this question of trust is concerned. Now, as far as social cohesion itself is concerned, I would sort of take a step back and tie it in to this question of preparedness that we talked about, or this question of security. See, if you take, for example, something like the COVID, the pandemic, right? What is obvious is to say that it's not something that's local. It was global in nature. So you have, to take a sort of a framework of what economists would call, if you look at it in terms of different types of goods, this is what is called a public bad, in the sense it does not respect national boundaries. Now, typically, when you build infrastructure, for most of which are provided as public goods, it might be roads, railways, and so on and so forth. They pretty much end with your national boundaries. That's what governments take responsibility for, and they attempt to deliver. It could even be healthcare or schools and so on and so forth. But when you have something like a pandemic, that knows or respects no national boundaries, right? Just to travel wherever it can go. So what that really calls for is, just like we have institutions to deliver public goods across countries, we need to have global institutions that will bring about that kind of cohesion to deal with these public bads. How do we mitigate these things, right? So we need new institutions and practices that are going to say, we can deal with it not just, or we acknowledge that this is not just an Indian problem or a Brazilian problem or a problem of some other country, but we need this kind of institutions that is going to, and we even saw during the pandemic the disparities despite the availability of technology in terms of delivering these vaccines that were widely available, but were not widely available. That's what I should say. Sorry about that. So I think these institutions are necessary so that you address these public bads, and it is through that you look at cohesion as far as certain kinds of challenges are concerned at a global level. Right? You build that cohesion, you build that preparedness to building those institutions, and you also therefore give ourselves collective security to know that tomorrow, should such an event happen, we got what it takes. Of course, it calls for a lot of political negotiation. It is not something that we can simply sit and dictate from a table here or there. But if we don't do it, I think we are setting ourselves up for trouble.
Prasada, I think what Balaji has just described is essentially what you lived and worked through with the HIV epidemic. You could have been talking, Balaji, about HIV.
Sure.
It seems to me. And it strikes me, Prasada, that trust has probably been, and the building of trust has been something that has been very central to your career. So how do you see the way in which governments and communities interact around trust in the 21st century, in this third decade of the 21st century?
Yeah, thank you. But before coming to that, I just want to respond to what Balaji has said about the international institutions, that you need those institutions to see that, we sort of drive the agenda. We have seen the experience of international institutions and their roles. I think unless they are very well defined, what they can do and what they cannot do, you may end up with a lot of optimism around, but not much happening at the country level. Ultimately, any international instrument you see, there is always a very small clause hidden somewhere, says that national authorities are ultimately responsible for implementing this particular agenda or convention or whatever. That means ultimately the buck stops with the countries. You cannot go beyond that, below that, and then start, implementing projects or telling people what to do. You have to stop there. And then that's where the nations and the national authorities need to be influenced, advocated properly with use of evidence, and also offer up technological support. I think so. International institutions, when you look at it, the two most important things they can do is evidence. I think that's what the listening project has done. The most important part is evidence. This is where I think, as you said rightly, in HIV, when India was in a denial mode, it was still in a denial mode when I joined. The first thing that we did was conduct a national level sentinel survey, collecting blood samples from a large number of general patients and also the so-called high-risk patients also, high-risk persons. And we analyzed and we found that huge amount of differential between the general population and these risk groups in terms of the prevalence of HIV among them. And when we aggregated, the total number of HIV positive people in the country came to something like 3 million, whereas the government was reporting a figure of about 90,000 or so. So that was a telling effect that had the evidence that we produced. And then when it went to the then Prime Minister, he said, no, this cannot happen. We have to come out of this. And then he himself made an open announcement on the floor of the Parliament that we are in a big problem. So we need to mount a big response, scale up our response, put more resources, etc. So I said, the power of evidence and how you can bring it to the countries, how you can help the countries to generate that evidence, and also global level advocacy. I think these are the two things what international institutions and also global initiatives like this can do. But if you look at the implementation part, the country and the national authority has a huge role to play. If you can't sensitize them about the importance of what needs to be done, it stops there. That's where I think we were able to successfully do it in the case of HIV. But in COVID, of course, it's a different story. Countries have responded differently because they saw a huge amount of emergency. Some countries immediately jumped into the response. Some countries took time. Some countries denied for some time, like even in the United States. For some time, I think there is a bit of a denial of the epidemic. But at least mercifully in India, I would say that the government listened to science, listened to good evidence. I think because of that, we have been able to get a good response. The jarring note was, of course, the 21-day lockout, which caused immeasurable misery to people, loss of employment, etc. And also the lack of a very critical component in the response, that is social support. Again, where the trust part comes in. If government thinks that I'll just give you a vaccine and okay, you can go home, I forget about you, that is not enough. You need to see that what follow-up need to be done, how the income opportunities of those people got eroded because of COVID, and what need to be done to bring it back. That didn't happen, somehow or the other. And even if it happened in a very, very, very minor scale, where again the trust part came in very heavily. And then I think I would say that the communities especially, their trust in the effectiveness of the government to come to the rescue has been seriously eroded.
Sobering. But I guess on the one hand, Heidi, we have the emergence of global bads, and Balaji, I'm definitely going to use that. That is brilliant.
Sure.
And then on the other hand, the need for national and indeed local actions, which is, good and bad. What does this say to you about trust, particularly in the context of human security?
Well, as Balaji was talking, I was thinking the other thing that goes across borders is technology and what's in technology and the sentiments shared on technology and the viral emotions that went around the world. And that's something that we really need to look at, to focus on, to get a handle on, because that can undermine any efforts, and it can also be an incredible asset, again, and to security, but to any response. One of the things that, one of the biggest conspiracies that was in every country was that there was some global government somewhere controlling the world. This was too big. There were too many people being asked to do the same thing. It didn't make sense. This was something that somebody made up somewhere. And some people, I heard a number of totally different people in different settings, from taxi drivers in one country to a shopkeeper in another to someone else who was, very educated, say, the vaccine's not for me. Not because they didn't believe COVID was serious. They knew people who had died. It wasn't because they had a real particular issue with their government. It was the global government. And right now, the world is having a difficult time getting coherence and agreement on a pandemic treaty. They're struggling. And what's that about? And I think that from the public perspective, there's a lot of anxiety about that because people, even though the UN and other global entities can only give guidance, and as Prasada rightly said, every country has their national sovereignty. They can get global guidance, but these things and recommendations do not become law or policy unless a country endorses it. But to have some global coherence is really crucial in these global crises. So I just come back to the other issue and why technology and the nature of technology is a hugely vast term. You can be talking about social media and you can be talking about AI in its biggest sorts. You can be talking about diagnostics and I mean, there's a lot. So we have to be a bit more granular in that. But the other thing that I was thinking about, and this came up in a lot of our questions on trust, in terms of who people turn to for support during COVID, from religious leaders to government, national and local, to media, national or local TV or radio, or were their employers. And many employers in the world these days are global institutions. And actually, they played a huge role in supporting people. And a number of people in our survey said that actually they helped them much more than the government. My employer, my wife's employer helped our family and our neighborhood because a lot of us work at that company. So I think we can't underestimate the importance of private sector and particularly international business that is in principle apolitical, which is another thing, because one of the problems and challenges with government, look at the United States, and there's a number of countries that are hugely polarized. And when guidance comes, when you said, do you trust your leader? Well, some said they trusted their leader, but he wasn't in the office of the president. And it was the opposition leader. And so, I think we really need a very diverse in it. If we want to get any sense of security, we need a mix because not everyone is going to follow the same thing all the time. They have their trusted group or entity, and we need to make sure that we're trying to get multiplicity of factors that build a stronger fabric of social cohesion, because it's not going to be the same threads, as it were, across the whole fabric, but we need to go with one of the local strongest threads of trust to build that patchwork of global blanket, like the HIV blanket, the AIDS blanket, around the world. And I think we touched on some of these issues earlier this week when we did a roundtable, and I just want to thank, before we wrap up, the Bangalore Science Gallery that hosted our first India roundtable. And really, that's where I had the opportunity to meet Balaji, and Prasada joined us, and we had a few other fantastic researchers and scientists here in Bangalore, but also networked across India. And I'm just thrilled to have this opportunity here.
I mean, it was great that you raised the India Roundtable, because that's where I wanted to go next. And I guess, Prasada, if I could start with you, you've seen the data coming out of the survey, and particularly as it relates to India. But I guess the question is, do you feel that India is in the process, like perhaps a number of other countries, of forgetting about COVID? And what lessons do you think the political class have taken from the pandemic for defending national security?
Well, I think one of the reasons why I joined the Global Listening Project was to say that, as countries start forgetting about COVID, this is one way of reminding them that what happened at the time and what were the responses. So bringing it back to the public memory, very important. So I think that's one of the important, I would say, that offshoots of the global listening projects. But coming to India and the COVID response, I don't think we can say in black and white that the COVID has been forgotten and is business as usual, etc. Because there are certain obvious advantages that the country derived in terms of technology, in terms of the infrastructure, in terms of the vaccines, and also in terms of the government's thinking on preparedness, pandemic preparedness. See, we have in India what is called a National Disaster Response Agency, NDRA it's called. And when you look at the work they do, they were focused more on natural calamities, serious law and order situations, etc. I think they were handling those things. But a public health emergency, like what we saw in COVID, they were not prepared for it because they never thought that a virus, an invisible virus, can sort of cause this sort of a huge damage to the people's lives and to the GDP of our countries, etc. But so everybody was taken by surprise. So we needed a totally different type of response when it came to COVID. I think the government rightly, handed it over to the Indian Council of Medical Research because they wanted to depend upon evidence, depend upon science to see that the response is on proper lines. And also the data that has come from the field, where exactly the epidemic is moving. So all those things have come up. So I would say that those things stayed on. When we now have a national disaster preparedness plan for emergencies like this, public health emergencies. Earlier, it wasn't there. Then in terms of the public health infrastructure, in India, oxygen concentrators or mini oxygen plants were not known earlier. We used to have big hospitals having big oxygen plants, but a primary health center or a secondary health center, they had to depend upon the cylinders for oxygen. Today, I think thousands of mini oxygen plants have come in hospitals so that they don't have to depend upon supply from somewhere else. But this is completely because of COVID. Similarly, if you want to do what you call the pathological labs, which do that sequencing, genosequencing, etc. Earlier, there used to be maybe 4 or 5 in the entire country. Today, almost a state probably has got 20, 30 such labs. They have been created and they are still functioning. So now any new virus that comes in, I think within a few days, we'll be able to say that is it a new virus or is it something which is old one which has emerged. So this sort of a technical capacity that has been built in the country, I think that's really stayed on with us. We are not forgotten that. But what has been forgotten, of course, is that yes, we need to invest in health, we need to invest in public health, and we need to invest in preventive health. I think that still need to happen in a large way. I mean, it's happening, no doubt, but I don't think the budgets that are available to public health authorities, they match the requirements to see that some of these public health emergencies can be met.
Balaji, could we go back then to the global perspective, good and bad? I think one of the things that we all learned through COVID is that India truly is a global power, whether it's the production of vaccines, the biotechnology industry that really is the drug maker for the world, the vaccine maker for the world as well, but also technology. And I just wondered, do you think India understands and is ready to take up a regional and indeed global mantle to help prepare for future crises?
That's a very hard question, both in terms of its scope and in terms of the time frame that you're sort of asking. The global mantle for the future, because in the long run, like John Maynard Keynes said, we're all dead. but more seriously, I think you used the term technology. You said India. I think you used the term technology leader, and then you said we're the drug maker to the world or provider of vaccines. All that is true, except that I think, like Heidi pointed out, technology is a very vast term. And I think, we do well in certain areas, like, for example, whether it's making vaccines or, or generic drugs, or maybe even sending up a satellite to the moon and so on. Yes, we do, a vehicle to the moon. We do certain things very well. We're also the world's largest exporter of software services, etc. But that does not, so there are specific areas. I think this is too broad a question, if you ask me, in the sense that we have to focus this on very specific areas. And because you can point to just as many areas of technology where we have not yet been able to deliver in a very, in things that people take for granted in many other parts of the world, right? Are we able to deliver clean water to vast sections of our population, right? That's something we haven't done yet. Now, it's partly technology, but technology by itself means very little unless you have certain institutional mechanisms. And I sound probably like a broken record, but you need to have those mechanisms, the social mechanisms that can appropriate those technologies and then figure out how to ensure that vast segments of the population get it. So it's, even if you did have that technology, you could well be like a lab or in a sort of a situation where it's on the shelf, it's glittering, but then it's not usable by many sections of population. Yeah. So it really is more than a question of having the technology. So whether we want to meet the needs of our own population, of our own citizens, or take on a global or regional mantle, I think what really counts in the final analysis is when it comes to, here's where, I'm sure somebody like Mr. Prasada Rao, who's been at the sort of shall we say, at the forefront of delivering these things as a policymaker and so on, he'll appreciate that. It's all good for us to say what we want, but do we have the mechanisms, the wherewithal? The availability of certain forms of technology, particularly digital technology, has made certain things easier, but it doesn't guarantee anything, right? Because there's, just to let me close with this one set of sentence and anecdote. A few years ago, a well-known American journalist wrote the book, "The World is Flat," right? But that had a very specific connotation. It wasn't that everybody was sort of getting along very well. No, it's just that certain forms of technologies became available, which made India a big software exporter. But nevertheless, has a vast majority of the population benefited from those exports? No, it's still an enclave, right? So we have to sort of think about it, step back and think about these things, not just in technology, but as technology as socially embedded mechanisms or processes.
Well, somebody has said you have to democratize technology. That's a good word I heard.
Yeah. And so what a great way, Balaji, to get us to some final comments from Heidi, because we're getting to the top of the hour. And I confess that in preparing for this launch event, I explored some of the new frontiers of technology, some of the artificial intelligence apps, and even went as far as to see if we could get some questions from ChatGPT or Proximity to put to Heidi. And there is one, Heidi, which I think I'd like to put to you, which I think is a really nice way of wrapping up this session. And excuse me if I quote from Proximity. Here we go. Ask Professor Larson, what behavior leads to better crisis preparation? Either leaders who demonstrate greater transparency and greater information, or leaders who tightly control what, when, and how information is shared.
Tricky one, yeah. Well, if we turn to our data, the thing that every country around the world prioritized in terms of what they wanted from government was more than anything, honesty, transparency, consistency. That was above a lot of other things, including their role at community level. That was much lower. What they wanted from government, just be clear, make a decision. We'll follow a top-down decision if you explain why. And you explain why these people are getting this before we are. We'll accept that, but just explain why. That's what people... So I Mr. Proximity, I'd go for the honest transparency, although with the caveat that in times of crisis, you do need a little bit of command and control, and people accepted that. Everyone we talked to said, we know in a crisis, especially with something new that is unfamiliar, we need someone to guide us. But they need to make that guidance relevant to our realities, our situation, if we can follow that.
And presumably the only way we can do that is if we have trust in our authorities.
And mutual trust. I think that's another important thing. It's not just trust up, it's trust by national authorities. And this is where Sweden, for instance, not to start a new conversation, but Sweden, as many people know, were less strict in forcing certain regulation, but said to the public, these are the measures we think and our evidence is showing is important to protect you. But we trust you to take on and respect those. We're not going to make it a law. We're not going to prevent you from going to places within the country, but we're going to trust you. Now, they had more deaths than Norway, for instance, which was stricter. Many other European countries were stricter. But at the end of the day, what was interesting is that when we looked at trust in government, they ended up with higher trust because the government, they felt a sense that the government had trust in their people. So I think this issue of mutual trust, both mutual trust among peers, family, community, but also building and working towards mutual trust between those who govern and make the policies and those who are expected to implement it, will have a much more secure and safe society.
Well, thank you very much. And what a great way to wrap up this session. Balaji, Prasada, thank you so much for joining us. And I know, Heidi, that this is the start of a set of conversations the Global Listening Project is going to have. Thank you so much for tuning in wherever you are around the world. You can find out more about the Global Listening Project at our website, global-listening.org. And there you can find, in a Power BI form, the data that Heidi's been referring to. So with that, thank you again very much. And as we say on a Shot in the Arm podcast, have a great week and a safe week, everybody.
Thank you.
Thank you, Ben.
Thank you.
Thank you, Ben.